Hey, future nurses, if you're getting ready for the NCLEX, you know that lab values can feel like this huge, messy pile of numbers. But what if I told you they weren't random at all? Today, we're going to crush it. We're focusing only on the must-know values. Let's go. Yeah, I get it. It's a lot. You got pharm, you got fundamentals, and then you have all these critical lab values that can pop up anywhere on the exam. It can feel pretty overwhelming. So that's our mission today. We are cutting through all the fluff to get right to the essential fluid and electrolyte concepts, the stuff you actually need to know, not just for the NCLEX, but to be a safe, amazing nurse. Okay, first things first, fluid balance. We have to start here. You know why? Because electrolytes don't just float around in space. They live in the body's fluid. Once you get how water moves, everything else with electrolytes is going to click into place. I promise. Look at this. The secret is so simple. Just remember this little rule. Isotonic solutions, like normal saline, stay where you put them, in the blood vessels. Hypotonic solutions go out of the vessel and into the cells, making them swell up. And hypertonic solutions pull fluid from the cells, shrinking them and bringing it back into the vessel. It's all about where the water goes. All right, let's jump into our first big deal electrolyte, sodium. When you think sodium, I want you to immediately think brain. Seriously. Sodium is the brain balancer. Anytime it's off, your first signs are going to be neurological. And here it is, the magic number, 135 to 145. Burn this into your memory right now. You absolutely have to know this range cold. Everything else we talk about with sodium depends on knowing this number. So here's what happens when things go wrong. If sodium is too low, that's hyponatremia, water floods into the cells, making them swell up like water balloons. When this happens in the brain, you get confusion and even seizures. Now, if sodium is too high, hypernatremia, water gets yanked out of the cells, causing them to shrink. What do you see? Intense thirst, restlessness, and, seizures again. It all comes back to the brain. Okay, moving on to the one that rules the heart, potassium. If sodium is the brain balancer, then potassium is the cardiac king. It is all about heart muscle and electrical conduction. Super, super important. And here's your next number to memorize, 3.5 to 5.0. Now look at that. See how tight that range is? That's why even a tiny shift in potassium can cause massive, life-threatening problems for your patient's heart. And this is what those problems look like. Low potassium, hypokalemia, gives you flat or inverted T waves on an EKG. High potassium, hyperkalemia, gives you those scary-looking tall, peaked T waves. Both of these can lead to deadly heart rhythms and cardiac arrest. You have to know the difference. Listen up, because this is one of the biggest safety rules in nursing. It's a huge NCLEX topic. You never, ever, ever give potassium as an IV push. Why? Because a concentrated dose will stop the heart instantly. It's lethal. It must always be diluted and dripped in slowly. No exceptions. Let's talk about calcium, the nerve and bone boss. Calcium really has two main jobs. It controls how our muscles and nerves fire, and, of course, it keeps our bones strong. And the normal range you need to know is 8.5 to 10.5. Lock it in. You're definitely going to see this one again. So what happens when it's out of whack? When calcium is low, the body gets super twitchy. You'll see two classic signs, Trousseau's sign, where you pump up a blood pressure cuff and their hand cramps up, and Chvostek's sign, where you tap their cheek and their face twitches. For high calcium, though, there's an amazing mnemonic that will save you on the exam. And here it is, bones, stones, groans, and moans. This is pure gold. High calcium means bones because it's being pulled from the bones, causing pain, stones because it forms painful kidney stones, groans from GI issues like constipation, and moans from psychiatric problems like confusion. See? Easy. Okay, you ready for a lightning round? Let's knock out magnesium and phosphorus real quick. These are super important, but we can cover the highlights fast. For magnesium, normal is 1.5 to 2.5. Here's the deal. Low magnesium looks a lot like low calcium, twitchy muscles, tetany, sync chronic alcoholism. High magnesium is the total opposite. It makes everything weak and floppy, leading to respiratory depression. And the most important fact? The antidote for too much magnesium is calcium gluconate. Remember that. Now, phosphorus. The number one thing you have to remember about phosphorus is its relationship with calcium. They are on a seesaw. They have an inverse relationship. So if calcium goes up, phosphorus goes down. If phosphorus goes up, calcium goes down. It's a key concept, especially for patients with kidney failure. Okay, you have absorbed a ton of info.
Now let's see if you can apply it. Time for a couple of NCLEX-style questions to really lock in these concepts. Ready?
First question. Your patient has severe hypokalemia, and they're hooked up to a cardiac monitor. What are you expecting to see on that EKG strip? Take a second. Think about it. If you picked C, flat or inverted T waves, you are 100% correct. Low potassium makes the heart cells less excitable, which flattens out those T waves. Those peaked T waves, that's the dead giveaway for the opposite problem, hyperkalemia. Okay, one more. A client comes in with hypercalcemia. Think back to our mnemonic. Which one of these symptoms would you expect to find?
And the answer is B, kidney stones. It's the stones from bones, stones, groans, and moans. All those other options, Chvostek's sign, muscle tetany, those are signs of low calcium or hypocalcemia. That little mnemonic makes these questions a piece of cake.
And that's our crash course. But here's what I want you to walk away with. Passing the NCLEX isn't really about just memorizing numbers. It's about knowing what those numbers mean for a real living person. It's about spotting the signs and knowing what to do. You've got the knowledge now. So the only question left is, are you ready to put it into action?